My name is Adriana Phillips-Rowe, and I work at Meridian Massage and Spa. I'd say my specialty is in deep tissue treatment work. I also specialize in pregnancy massage, cupping, hot stone, but the deep tissue treatment work combined with the cupping sometimes I would say is my specialty. There are a lot of common ones, and headaches, migraines. We get a lot of people that have rotator cuff pain, so pain lifting their arms, or even just like driving. Sciatic pain, which goes hand in hand with low back pain. Those are probably the main ones. Sometimes foot pain, plantar fasciitis, we can work that out pretty easy. So those are the most common ones that when I hear that, I'm like, I can definitely help them back. A little over 4 years. So I graduated about 4 years ago, and I've been working as a massage therapist ever since. I've been here at Meridian Massage for just over a year, about 13 months. I personally believe that everybody could benefit from it, and ideally everybody would be getting a massage regularly, like about once a month, even if they feel like they don't have any serious pain, just to help prevent pain or just to help with things, maybe they have some more mild pain they've learned to block out. But especially if someone's having chronic, recurring pain, difficulty doing their job, or certain tasks that they can't do, pain sitting on the floor, any sort of pain that it's not just like a one-time thing. And then of course injuries, we can help with those as well. But for people who are having long-term pain, it's often something that's muscle related in some way that we can help out with. You definitely want to find someone you're comfortable with, of course. And then I think communication is really important. So someone who is open to your communicating, who's asking you how things are feeling, what's the pressure like. Everybody is different. There's a lot of similarities, but everybody's different in where they're going to feel pain. And so it's really important to communicate what you're feeling, what's too much, what's not enough in some areas. So I think communication is really important. And then someone who matches like the style you're looking for, whether it's more Swedish relaxation or more medical treatment to help relieve pain. Initially it was receiving my first massage. So I didn't really know anything. I didn't even know massage existed till my mid-20s. And then I decided to treat myself on my birthday to my first massage. And it blew my mind, so to speak. I just was amazed. Like, I felt so much better physically, mentally, emotionally afterwards. And I remember thinking, well, afterwards, this is a way that I could help create a difference in the world, like help people, because it literally changed my life. So then I started kind of like talking to my family members who had pain and just playing around, trying to help them. And I was able to help my mom with a rotator cuff problem that she'd had for years and nobody could figure it out how to help her with it. And my husband had really bad low back pain from his job, and I was able to help with that. So then I decided to look into schooling and made that commitment to get trained. It kind of relates to, my answers are kind of similar to the one from one of the other questions you asked. I think communication is a really important quality. Another one I think is adaptability. Like not doing the same thing with everyone. Like some people have routines that they do, and I think it's really important to remember that everybody's different and you can't just do the same treatment for every person that has the same problem. And also learning new skills, always being open to learn new things, especially if you have a patient who has some pain that is taking a little longer to get rid of, you might have to, take a new class or do some research or try something new and try to figure out how to help that. It's definitely the success stories. Hearing people either right away saying, oh, that feels so much better, or next time I see them, hearing that their headaches went away, or they got to stop taking, a pain medication, or stop wearing a wrist brace, or things like that. That's my favorite part. I just love the environment of working here too. It's a calm, beautiful place to work. We get to listen to relaxing music all day, and it's a pretty easygoing, fun job. Also, that it's never the same. So it's never boring. I never get bored. Everybody I work on is different enough that it's always interesting. So, yeah. The physical aspect of it, being aware of your body mechanics. It took a while. I'd say the first year I was a massage therapist, I wasn't as aware of proper body mechanics, and so you're more prone to injury that way. So it's super important to be aware of that, and sometimes we get so caught up on what we're finding on a person's body that we have to remind ourselves to, take care of our body as well. And if we're working on someone in a position that's not good for us, it's not going to be as good of a massage for them either, probably. So that's definitely the most difficult part, is just taking care of my own body mechanics when I'm working on a client. Definitely deep tissue. Oh, I forgot to mention earlier that I also do cupping, pregnancy massage, hot stone. So any sort of deep tissue work, but I also enjoy being able to incorporate some of those other things, especially cupping, into my massage. I'd say those are my favorites. My favorite type of massage to receive is also my favorite type of massage to give, which is deep tissue treatment work. So it's actually something I've noticed is that I tend to like to work on people in the similar ways that I like to be worked on. So deep tissue work, help alleviate pain that I have in my body. I take continuing education courses. So as a massage therapist, we are required to take a certain number of continuing education classes every 2 years. So I take classes, and then I also will sometimes go through books from school to get ideas about different sorts of treatments, or even look up videos online just to get new ideas and suggestions. Also, receiving massages. Another way to learn new techniques is to receive as many massages as you can. Every time I receive a massage, I learn something new that I can then incorporate into my own massage techniques. First of all, receive as many massages as you can. Kind of goes hand in hand with what I was just saying. Like, you're going to learn a lot from receiving massages from other people. And then you'll also be able to understand better what your clients are feeling when you're doing certain techniques to them. And secondly, have confidence in yourself. It doesn't matter that you've only been, officially certified a few weeks or a few months. Have confidence in your abilities. You've gone through school, you know what you're doing, and you're going to be able to help people regardless of how new you are. So just have that confidence when you go into the massage. Communication with your client is also a recommendation that I have. Making sure that you're having them tune in with their bodies and report to you what they're feeling, and be able to be adaptable in that way and communicate what you're doing with them.